Hello and welcome. Today I plan to briefly talk about the health care bill. By way of background, over the last 40 years, I have been a CPA, a Chief Financial Officer, a Chief Operating Officer, and an entrepreneur. I have substantial business and financial experience, and I have administered healthcare plans for both large and small businesses. I'm a private citizen trying to make some sense out of this bill. I've been waiting for somebody to produce a decent financial analysis. So far, nobody has, so I took a look at the numbers myself. So let's hear what the numbers have to say. The numbers you're about to see are not mine. My source is the Congressional Budget Office, the CBO report, which everybody seems to agree is an unbiased source of data. In this analysis, we'll listen to the numbers. We will review the planned spending increases and see if we're getting the bang for the buck. We'll take a look at how we are expected to pay for it. We will examine the cost of the new insurance exchange being set up. And surprisingly, there is a public option. It's received so little attention, most of us thought it was not in the bill. But it is, and it's in the numbers, and we'll look at it. We'll see if the numbers verify this bill actually reduces the deficit. And finally, we'll summarize the main conclusions. So let's start with the spending. Here is a pie chart of where the money is being spent. And if I had $1 for every time I heard mention of pre-existing conditions, I'd be a rich man. You would think it would be a dominant piece of the total. But look at it. It's so small, you could barely see it. The same goes for the spending on wellness care. Here is an opportunity to make a real investment to not only improve the quality of health, but to also reduce the cost of care. Here again, it is only a small piece of the total. Talk has been much, much larger than the dollars. Medicaid is a big piece of the cost, representing 41% of the total. Though pre-existing conditions have held the spotlight, we have at least heard about the discussion on Medicaid. By way of background, this is our universal health care plan, which was adopted in 1964. Half of the program is paid for by the federal government, and the other half is paid for by the states. By all accounts, it's very good coverage. This bill is increasing the income thresholds so that it will cover an additional 15 million people. However, the CBO does not include the state's half of this cost in its calculations. Since the increase in the state cost must be considered, we have to include that in our analysis. I'm not sure why we don't use the Medicaid program to cover everybody. Instead, we are setting up a new apparatus called the National Insurance Exchange, and we'll discuss that further. Also, if you listen to the rhetoric, you'd think there was no public option in the bill. But when you look at the numbers, there it is. Further, these two items make up the lion's share of the cost, yet they receive the least amount of discussion. So let's discuss that a bit more now. The National Insurance Exchange is a new watchdog agency that will create new rules and standards, set the prices, and control oversight and enforcement. In fact, they're hiring 16,000 IRS agents to help with the enforcement portion. The public option is established clearly under Section 221 of the bill as one of the exchange-qualified insurance plans. This is, in effect, a government-run insurance company. It will be offering different types of policy, and it is also projected to operate at a substantial loss. This plan will be in competition with other private insurance companies. So let's take a look at how effective it is. And what I thought I would do is look at the year 10 data. By then, you could expect that the efficiencies of the plan should all be worked out and that all the startup costs are gone. So this should be the most cost-effective year of the program. In year 10, the total cost of the exchange, the public option, and Medicaid is $362 billion. Divide this by the 36 million additional participants being covered, yields a cost of $10,000 per person, and this is over $40,000 for a family of four. This is unbelievably expensive. My 27-year-old son buys good insurance coverage for $2,500 a year, but health insurance under this plan is going to cost 4 times that. I am 58 years old, so my insurance should be more expensive than the average. But this plan costs even more than my plan, 67% more. To realize how really outrageous this is 49% more expensive than Cadillac plans. It's not that the benefits are better, it's just that the costs are higher. If this was a private company with this cost structure, it would definitely go out of business. But since it's the government, they simply raise taxes. So let's take a look at how they're going to do that. Here is a pie chart of how they're going to pay for the costs. One of the big chunks is an increase in the income taxes. And this is on a variety of different income streams, including having a Medicare tax on interest and dividend income. Although it's a Medicare tax, it is not going to fund Medicare. It's going to help reduce the deficit caused by this bloated insurance structure. The next big funding source is a huge reduction in the Medicare benefits. This is taking benefits away from the elderly to pay for the bloated structure. We're also going to charge penalties on companies and individuals who choose not to have health insurance and hire 16,000 IRS agents to enforce it. And we're going to reduce other services and increase and create other new taxes. So the net is this bill is taking away from hard-working taxpayers and our senior citizens, only to waste it on an unnecessarily complex, expensive experimental program. The final question, does all of this reduce the deficit or take us deeper in debt? So let's take a look at that. The CBO projects a reduction in the federal deficit at the federal level of $130 billion. But that's only part of the story. The CBO does not account for the increasing burden on the states, and we still have to pay for that. Not including that in the deficit analysis is truly deceptive. Including it means that this program will increase the deficit by $352 billion, not reduce it by $130 billion. And I also think it's sleight of hand if you cut the benefits in one program, like Medicaid, to fund another. So the true deficit of this program is really $812 billion. So let's summarize. The CBO numbers clearly show that this huge health insurance exchange is an inefficient bureaucracy that wastes mega taxpayers' dollars. We are creating a money-losing government-funded insurance company, i.e. the public option, that is in competition with private insurance companies. And if you don't believe me, take a look at Section 221 of the bill. We will incur huge increases in taxes, incur personal penalties, and we will take benefits away from the elderly to fund this bureaucracy. And still, we will increase the deficit and our debt burden by at least $350 billion. What are the CBO numbers telling us? I think they're telling us to start over. Thank you for listening to me, and have a good day.